The Intra-aortic Balloon Pump, IABP, is a circulatory support device used to assist a failing heart. For a healthcare quality professional or an ICU nurse, it represents a critical bridge either to recover after an IME, to surgery, or to a more permanent ventricular assist device VAD. In simplest terms, the IABP works on the principle of counterpulsation. It does the opposite of what the heart is doing. How it works: the balloon sits in the descending thoracic aorta, just distal to the left subclavian artery. It is timed to the patient's ECG or arterial pressure waveform. 1. Inflation diastole. The balloon inflates at the onset of diastole when the aortic valve closes. The benefit: it pushes blood backward toward the heart, increasing coronary artery perfusion. It also pushes blood forward toward the rest of the body. Quality goal: increase oxygen supply to the heart muscle. 2. Deflation systole. The balloon deflates rapidly just before systole, right before the aortic valve opens. The benefit: this creates a vacuum effect suction in the aorta, which significantly reduces afterload. The heart doesn't have to work as hard to pump blood out. Quality goal: decrease myocardial oxygen demand. Indications and contraindications: use it for cardiogenic shock, when the pump is failing and needs help; weaning from cardiopulmonary bypass after open heart surgery; intractable angina, pain that doesn't respond to meds. Never use it for absolute contraindications. Aortic regurgitation: if the aortic valve leaks, inflating the balloon will just push blood back into the left ventricle, causing massive distension and failure. Aortic aneurysm: dissection. The pressure from the balloon could rupture the aorta. Nursing priorities and quality capsule monitoring. Managing a patient on an IABP requires high-level vigilance. The quality of care is measured by how well you prevent complications. 1. Timing is everything. Triggering: most pumps use the R wave of the ECG as the trigger. Timing errors: if the pump inflates too early before the valve closes or deflates too late, it actually increases the workload of the heart, doing more harm than good. 2. Assessment of perfusion. Left radial pulse. Since the balloon sits near the left subclavian artery, if it migrates up, it can block blood flow to the left arm. Urine output: if the balloon migrates down, it can block the renal arteries. Monitor UOP every hour. Pedal pulses. The large catheter in the femoral artery can cause limb ischemia. Check the 6 P's: pain, pallor, pulselessness, etc. in the effective leg. 3. Safety measures. Log roll only. No hip flexion on insertion side prevents catheter damage or aortic rupture. Watch for bleeding. Check site for hematoma plus monitor platelets daily. Brown flex alarm: blood, flakes in tubing equals balloon rupture. Give stop and pump immediately emergency.